Hey y'all, it's Dr. Tiffany. I hope you're doing well. And with me, of course, is Audrey. So, this is your COVID and flu update. Well, the good news is there's a good news this week in that all markers are trending down across the board. So, we have definitively passed the peak. Trends in the hospital admissions is down 14%, ER visits down 16.3%, and deaths have finally started falling down 7.5%. This means we are on the backside of the curve. That doesn't mean all's rosy. I'm going to show something at the end that's going to that's going to be a bit of a reality check. But first, the good news. So this is the green map, the one that shows the new hospital admissions per 100,000. And as you can see there, from last week to this week, there's definitely a lot less yellow and orange on the map. There's a significant burn still going on in the Mid-Atlantic and New York and southern New England. And there's still a significant hot spot that actually appears to be rising a bit in Oklahoma and West Texas. So if you live in those areas, do be advised that it's still not getting a whole lot better there. But the rest of the hot spots have cooled down significantly, which is nice. This is the percent rise or fall of hospital admissions, which is the strongest indicator of real time. Is it getting worse or better in your neighborhood? This is last week, still a lot of orange, especially in the south. This is this week. As you can tell, there is definitely a decrease in orange and yellows from last week to this week. So once again, that burn does continue in Texas and Oklahoma, and the Four Corners region still has a little bit of a surge ongoing on this map. But the most of the eastern half of the country is definitely falling. Just those two areas of concern. There's still high rates of infection in some of these places, so don't let your guard down too much, okay? Moving on to the flu. This is from a couple of weeks ago, and this is now. You can see there's a definite cooling off, although the levels still remain high, especially across the southern portion of the nation and up through some of the Rockies and into New England. So there's still quite a bit of flu going around. But it's kind of following the same track as the COVID surge. So, but here's respiratory illnesses, when compared to years prior and where we're at right now. See, we're this red one, and see we equaled the past highest surges, and then we came down to there. So look at that. We're still really high, okay? There's still a lot of infections going on. And as you can see, it's starting to drop a little less sharp. So we're going to have to watch that, because look at these two of the years afterwards. 2018 to 2019 and 2019 2020, quote, normal years, it continued significantly past that. So there's no rule saying that we're going to drop down to below the considered safe zone, okay? We have to keep an eye on this, and a lot of people are still going to get infected. We still have about 35% of the surge left for COVID to go through. That means 35% of the infections have not happened yet. So don't be that person who gets, knocked off in the end of the movie when everything's supposed to be safe. So do stay COVID conscious, okay? Do stay flu conscious. You don't want these problems. They suck. At the very best, you get a week ruined. So be careful. I love you. Stay safe.